Hey everyone, welcome back. Let's discuss the 7 best foods to consume for Candida. And boy, what you eat really matters. Case in point, clinical trial found that a prescription antifungal alone compared to a antifungal with a Candida diet was twice as effective than just the medication alone. So we'll discuss what this study utilized regarding a diet. We will fill in a few of the gaps because as great as this study was, it wasn't a super comprehensive food list. So we'll give you a little bit more detail. And then also, we will set the record straight on caffeine. And if you go and research online, Candida diet and caffeine, you will read wildly differing things. So we'll provide you with some direction and a clear answer there. And then finally, a few techniques regarding what you can do with natural supplements if you've gone on a Candida diet and you haven't seen full resolution of your symptoms. Okay, so let's begin. Candida is a type of fungus or yeast, and it is normal in the human microbiome. However, when your immune system is not fully healthy, the Candida can then morph into a opportunist. Now it's looking to sort of take advantage of that weakness of the immune system or perhaps an imbalance in the bacteria that sort of crowd Candida from overgrowing. And when Candida transitions into this opportunistic form, they generate what's known as hyphae or tentacles that anchor down into tissue, and this causes an inflammatory and immune response. This explains some of the symptoms that we'll see when a person is struggling with Candida overgrowth. Digestively, you may notice that you have gas, most namely as flatulence, bloating and pain, and also a hallmark is looser bowels. Given that inflammation can impact the brain, you will see fatigue. In fact, some studies have found a higher level of Candida positivity in those even with chronic fatigue syndrome. Brain fog, depression, and anxiety have all been also correlated with Candida. About 75% of women in their reproductive years will have a bout of vaginal Candida, and some of you may notice this waxing and waning, either jock itch, armpit fold rashing, whiteness of the tongue, or bad breath. And these are also indications that Candida might be present. And carbohydrate cravings, or perhaps said more accurately, you may just have this feeling that I'm not quite satisfied after a meal unless I have a little sweet of some sort or something starchy. That's a potential flag that Candida could be present. Things that expose you to risk of having Candida would be prior antibiotic use. The more you've used, the more at risk. Alcohol consumption, the more you drink, the more at risk you are. Poor sleep, stress, and then hormonal contraceptive use or estrogen hormone replacement therapy use. We've also developed a scoreable questionnaire that we'll link in the description. So if you wanted to do a self-appraisal, that's available for you. By the way, if this has been helpful, please subscribe, comment, and share this with one person you think it might help. Okay, so now coming to the diet. As a brief preface, the study I opened with was a 2018 clinical trial, 120 patients with gastrointestinal symptoms plus Candida overgrowth documented via a stool test. They were given either nystatin, an antifungal drug, alone, or that drug plus diet. Now, the drug alone group had a 42.5% resolution of symptoms and Candida in their stool. But if they combine that with diet, the results jumped to 85%. So they doubled the success rate with diet, hence why it's so important. So we'll start off with the first food, which is low glycemic load fruits. Now, glycemic load is similar to glycemic index in terms of it tells you not only how much the food will impact your blood sugar, but also the total sugar or carb in the food. The study recommended 1 to 2 servings per day of lower sugar fruits. So how we action this into a diet plan is quite simple. You want to emphasize things like berries and apples, and you want to reduce, and reduce doesn't mean completely eliminate, but have one or maybe half a serving per day. Just be careful not to consume a lot of higher sugar fruits, bananas, pineapple, mango, and I would definitely be careful with dried fruit because this is the highest in sugar. And it's really processed. It's not highly processed, but it's processed. And the processing impacts the sugar to fiber ratio and the glycemic index and glycemic load. And we will link to a more comprehensive food list. I'm not going to go through literally every fruit, but this gives you a high level. And then again, a fuller list is at your disposal. We will link to it in the description of this video. Okay then, so coming to food number 2, this would be lower carb vegetables and legumes. This would mean something like broccoli, Brussels sprouts, asparagus. Focus on these. Great. You'd want to be a little more careful with things like potato, sweet potato, carrots, beans, and chickpeas. You can have some, but this would be a food where if you overdo it, it could be a problem. So why am I not giving you super black and white, go low carb? That can work. And if you go on a low carb or very low carb diet, that will be a Candida diet. However, as a clinician who works with people, you are confronted, you are slapped in the face with the reality that not everyone does well on a low carb diet. And most namely, I would say that it's women and people who are undergoing a lot of exercise, which would include myself. And I've also noticed and seen in the clinic that if people go too low carb, they can have problems with sleep, problems with energy, problems with mental clarity, and in some cases, in women, things like thinning hair and interruptions of their cycle. So we want to navigate the nuance so that you can steer away from going too high carb, but not be shoehorned into going definitionally low carb or even keto. So you can have some cooked potato, sweet potato. You want to avoid things like potato chips and corn chips. This is a nice transition into the third food, which is whole grains. Now, in this study, they did not recommend people to avoid gluten. So there was no exclusion of wheat, barley, and rye. And as we documented, there was an 85% improvement in symptoms and stool candida. So you don't have to go grain and gluten-free on a candida diet. And this matters for the people who may not do well, definitionally, low carb or keto. So the recommendation here is that whole grains are okay and avoid processed grains, and only avoid gluten if you know you have celiac or non-celiac gluten sensitive. What this looks like is brown rice, okay, white rice, generally avoid. Whole grain bread, okay, whether that be a gluten-free bread or a gluten-containing bread, you want the sort of a little bit darker color, a little bit heartier of a feel, and you want to avoid the white bread, the sort of thin bread. And I'll use one bread that I like, Udi's. They have gluten-free breads, just for those of you who are wanting to adhere to gluten-free. Not that you have to. Udi's makes a whole grain bread and a gluten-free whole grain bread and a white bread. And you can see and feel the difference in terms of the white bread is white, it is light, it is thin, and the whole grain bread is heartier, heavier, and this matters as it pertains to candida. And again, for a more comprehensive list, you can see our food list, but this gives you the high-level direction that should be able to inform the decisions that you make with the breads that you eat. Not the white rice, the brown rice, not the white bread, the whole grain bread, and that should be enough to get you most of the way there. I do want to make one quick aside. There, in my view, are sort of these two different gut types, what we would call a bacterial or a SIBO type versus a fungal type. The people who have SIBO or kind of your classic IBS, they will often remark vegetables and fiber, things like broccoli, asparagus, a lot of the foods allowed on this very list flare me. And they may say, yeah, the worse I eat, the better I feel because I eat white rice and potatoes and starches and I feel great. That's your bacterial IBS SIBO type gut. The opposite is generally true for a fungal or Candida type gut. If they eat worse, right, the worse they eat, usually the worse they feel. So if they have lots of potato, lots of white rice, starchier foods in general, they're going to feel it in a bad way. So just to orient you, this can sort of help reconcile some of the lived experience you guys might be going through and obviously give you direction with your diet. Okay, coming to the fourth food, lean meat and fish. A 2013 observational study did find that higher protein intake correlated with lower levels of Candida. There's one little nuance here, which is you want to avoid processed, and the more processed, the worse it is, meats. Why is that? Because processed meats oftentimes have added sugar. In fact, look at labels on some beef jerky as an example, or really any jerky. You will be shocked how much added sugar. In fact, you may see the second ingredient to the actual meat is sugar. So we want to be careful of added sugars. And also, many processed meats will add emulsifiers, and emulsifiers damage the lining of the gut, and this can open the door for any sort of imbalance, whether it be fungal, candidal, or bacterial. So eat high quality protein and focus on eggs, chicken, turkey, beef, things like salmon. Whey protein is fine. And be careful with, doesn't mean you can't have any, but generally limit the beef jerkies, the bacons, and especially things like hot dogs and deli meats. The fifth food, healthy dairy. Again, added sugar can be a problem here. So consume unsweetened dairy, unsweetened yogurt, ghee, butter, and cheese is likely okay in moderation, although you'd want to avoid moldy cheeses like brie and blue cheese. And again, just be careful using yogurt as the example. There's a big difference in the amount of added sugar with a plain unsweetened yogurt as compared to a vanilla yogurt, a honey flavored yogurt, a blueberry flavored yogurt. And it's those added sugars for a Candida type gut that add up quickly and can be problematic. Again, more details in that full food list, but this gives you the fifth food, healthy dairy. Coming to the sixth food, cooking oils. One study here I found really compelling was the use of MCT, or medium chain triglyceride, when given to preterm infants, reduced levels of Candida. So this is definitely one to consider including. And most oils are going to be okay, and some even have direct antifungal or anti-candida activity, including olive oil, safflower oil, sesame oil, MCT, and what that is derived from, coconut oil. You should, again, be careful with, let's say, a salad dressing for the added sugar. So just make sure you check your labels. And then the seventh food are herbs and spices. And thankfully here, many of these not only will help improve the flavor profile of your food and reduce the amount of sugar you need to add, but again, they're also anti-candidal. So this would include oregano, ginger, cinnamon, turmeric, black pepper, cumin, and bay leaf. And coming to a few controversial foods, some suggest complete avoidance of nuts and seeds. There's no studies showing that nut and seed consumption increases Candida. Some may be more prone to mold overgrowth, so you'd want to focus on nuts and seeds that are known to be lower in mold. These include almond, chia, flax, pecans, pumpkin, and be careful with those that may be more prone to have mold on them: cashews, peanuts, pistachios, walnuts, and Brazil nuts. Doesn't mean these are out of bounds for most people. I would simply say trial them and see if you notice any sort of aversion. And if you're not sure, if you're early phase, you're trying to be most careful, then don't include these out of the gate, but then perhaps after a few weeks or a month in, you can start to experiment with these, which does touch on another really important concept, which is as your gut heals, as your Candida balances, you should become more tolerant to these foods and be able to achieve food freedom over time. So like with any elimination diet, these are more so a month or 2, maybe 3 if your symptoms are somewhat severe. But once you've been improved symptomatically and you've been stable in that improvement for about a month, that's when you want to start to test the waters, because you will not need to be on a elimination or a specific diet plan forever. Does that mean that lots of added sugar or a high amount of starch and high sugar fruit intake is going to be okay? Perhaps not, but there's some wiggle room between a Candida diet and then going all the way to that extreme of high sugar, high starch, high carb. Regarding sweeteners, this study did allow stevia and artificial sweeteners. And I know some people are not fans of artificial sweeteners. However, just reporting the data objectively here, when people use those as sweeteners, they seem to have done pretty well given the 85% response rate. This study did recommend to avoid honey and high sugar sources, and we'll give you a more comprehensive list in that diet handout. But focusing on things like stevia, monk fruit, and erythritol are probably going to be okay. And then avoiding things like cane sugar, maple syrup, honey, and of course, high fructose corn syrup. Fermented foods. The potential benefit here is that fermented foods contain probiotics, and probiotics are fairly strongly antifungal, anti-candidal. There are no studies, however, looking at those with Candida and the effect of fermented foods. Some, anecdotally, suggest avoidance due to the presence of Candida and other yeasts, which some people might be reactive to. So this is one that you'd want to sort of personalize. And especially with fermented foods, be wary again of added sugar. Kombucha is one in which added sugar can be quite problematic. So I'd be very careful with kombucha. But things like kefir, kimchi, sauerkraut, and yogurt will likely be okay for most. Some may notice an aversion, and it could be due to the yeasts therein, or for some of you, you might be histamine sensitive. So if you're not sure, just start on the diet without these foods. Give yourself a week or 2. Get to a point where you're feeling fairly level. Trial some fermented foods. See how you do. If you feel good, continue. If you notice a negative reaction, don't. Really simple. Okay, now coming to caffeine. So some make the claim that caffeine raises cortisol, and cortisol skews your blood sugar and it suppresses your immune system, and all this stuff about how cortisol is bad for you. Therefore, it fuels Candida. Well, there's not any rigorous science investigating this, so all we can do is speculate. What I would offer you is the results of 2, given their in vitro studies, so they're not high quality, but it's all we have right now, studies finding that caffeine inhibits Candida. When we combine that with the overwhelming data showing that regular caffeine consumption improves multiple markers of health, then I think it's somewhat safe to conclude that caffeine, as long as it's not delivered in a vehicle of a super high sugar drink, is okay. We've also done a review video on the health benefits of caffeine if you wanted to do a deeper dive there. And then to round out our discussion, a few supplements you can consider. Firstly, probiotics. Clinical trials have documented that probiotic supplementation can be a powerful anti-candida and antifungal treatment. So certainly a foundation would be probiotics. In the past, in other episodes, we've discussed a wonderful study comparing garlic tablets to the medication fluconazole, and they found that 1,500 milligrams of garlic capsules per day had a similar effectiveness as the drug fluconazole. So another option is garlic. And a newer, at least to me, fresh off the press here, 2024 in vitro study looking at artemisinin, which is a derivative of wormwood. They found that artemisinin can actually inhibit the Candida biofilm and suppress, remember those filaments, those tentacles, so to speak, the hyphae? Those can be suppressed by the use of artemisinin. So perhaps in cases that are more resistant, artemisinin could be a powerful adjunct. You do want to be careful with artemisinin because using it for too long can be problematic, and some organisms can develop resistance. This is why you'll often see artemisinin used at 6 to 1200 milligrams per day for 3 days, and then 11 days are taken off, and it's repeated in this sort of pulse cycle. But this is one, I think if you're considering the use of artemisinin, I would just check in with a healthcare provider because they will likely be able to help you utilize this the right time, the right place, and in the right way. And the final supplement I wanted to touch on was the elemental diet. Now, the elemental diet is a meal replacement that's formulated to be very gut friendly and gut healing and reparative. And there's a lot of data showing the benefits therein. However, because the carbohydrates are maltodextrin in most cases, or dextrose, these are more simple carbs. The merit of this is that they absorb in the first 2 feet of the small intestine, thus giving the entirety of the intestinal tract a chance to rest and repair. However, it does pose a potential contradiction in the sense that this is a fairly high carb formula. So what does the research say? There's not a lot of data here, but in 2 studies in children with inflammatory bowel disease, wherein some cases of inflammatory bowel disease may have fungal overgrowth, and one hypothesis as to why either Crohn's or ulcerative colitis begins is due to fungal overgrowth. These 2 studies found either no negative impact from the elemental diet or a reduction in Candida. So again, I don't think we have enough data to make a very confident decision here. However, I do think it would be worthwhile to trial an elemental diet for anywhere from 1 to 4 days and see how you do. You will notice within a day or 2 if you feel better or if perhaps you're noticing your symptoms flare. So it can be a quick and simple experiment to run. So in close, what you eat really matters regarding Candida. It's also not highly precise. We want to think big picture and be careful not to make everyone go onto a very low carb diet, because for some people that's going to interfere with energy, with brain fog, and with sleep. And that, of course, can be super problematic. So experiment and personalize over time. With time, you should have improved tolerance. So just bear that in mind. And remember that adjuncts could be probiotics, garlic, artemisinin, and the elemental diet. Well, please do let me know how it goes or what you think. And per the usual, I hope this helps you improve your health.